Welcome to the Dental Handoff. I am Dr. Kelly Tanner, your hostess. And today I have with me a pretty special guy who's working on some cool stuff to help offices be more prepared medically. And I cannot wait to hear about all the things that you've been doing, Dr. Marn, also Richard. So welcome to the show.
Thank you, Dr. Tanner or Kelly.
We agreed before that we were going to call each other by first name.
Yes. I think it flows better, It just better dynamics.
I totally agree. So always the question I start with is, I know you're an MD, but why dentistry? Like, we're talking about some dental stuff today. So how did you make the jump from MD to dentistry?
So I was working in the academics at Mount Sinai Hospital here in New York for many years. And I would do some dental cases in the hospital. And my wife said, "Hey, why don't you consider doing that in dental offices? There's a need for sedation in dental offices."
Oh, yeah.
And so I started looking into it. And my wife, incidentally, is a pediatric dentist. And so I started to learn how to do dental sedations in the dental office. And my wife was one of my first clients. And from there, I started snowballing. I left academics. And since 2016, I've been working in dental offices, especially for kids, doing dental sedations for kids.
Oh, wow.
So that's how I got into it.
Many offices?
Yeah, I'll go all over. I've worked in Ohio, metropolitan New York City, New York, and parts of New Jersey. So it's basically a mobile anesthesia service is what I do clinically.
That is so cool. That is so cool. So your wife is a pediatric dentist, was a pediatric. Yeah. And so you got to see some things that maybe opened your eyes. So yes. What did you learn that was different than what you were used to seeing?
You mean in terms of dentistry itself?
Dentistry, different things that dentists need to be prepared for. Like what was different?
Well, what my wife one day, this is around 3 years ago, she said, Richard, I think there's there needs to be better education for medical emergencies. And I said, what do you mean? I said, well, I'm in the dental offices. I never really kind of thought about it. And she said, I don't think our team overall is going to be ready. I don't think a lot of teams are ready for medical emergencies. And she recalled this event where when she was training for her pediatric dental residency, how she had a near miss event where they were sedating a child for oral sedation, and the patient turned blue. The oxygen saturation went down very low. They called for help very quickly, thank God, and all these medical people came in. They were connected to a hospital at the time, and it left an impression on her that the dental team did not know how to respond appropriately. And all the medical team responded to the kid, got the kid back, kid's fine, great. But it left a very impression on her that made her feel like we're not ready. And also on a separate tangent, that she didn't want to do oral sedation in her office, which is another story. But that stayed with her. And I guess she started seeing me working in pediatric dental offices and said, Rich, I think there really needs to be more help there. And she started, so I started looking into it, and I started looking at case reports and what was going out there in the dental education. And I started seeing that how I was trained, how other hospitals, especially the best hospitals, were approaching medical emergencies was different than how the dental industry as a whole, but even in pediatric dental industry and their practices approach medical emergencies. There's a huge gap in those two industries. And so I started looking at where's that gap? Why is it so different? And that's kind of what led me start to dive into this whole medical emergency readiness for pediatric dental practices, because I want to I've always been interested in teamwork, but I also want to make the people I work with and the environment I work with safer. And I want to make my wife feel more confident and competent. And I want her team feel that way too when she's taking care of kids, whether they're doing sedation or not. And so that's what kind of propelled me and led me to do a little more investigation and find the right people to help build, systems and programs so that the dental teams can become prepared for these events.
Wow. Okay. So yeah, you went from that into discovering that there was an issue with how they should be responding. Now I know with like me personally, medical emergencies, we renew our CPR. It depends on the state and where you live of how often you have to renew that, right? Based on your state board. So you're saying that that's not enough. You're saying on top of all of that, the medical emergency preparedness, like a med cart, those types of things, regardless of sedation, like whether sedation's going on or not, that needs to be present.
Well, I think the dental industry, and let's just say that as a group, because that's the mindset, is that people often ask, oh, well, we know medical emergencies are important, but they don't, people have a lot of misconceptions about that, which is why people think, oh, I think I have enough. So one of the misconceptions is people think CPR is enough. Another misconception is a lot of people, especially the doctors, dentists, think, oh, I'm a dentist, I'll figure it out. They often think also that 911 will show up in time, when really it takes about, just in New York City in 2022, it takes about 9.5 minutes on average from when you call 911 to when help will arrive. That's an average. I read in a separate paper in Atlanta, it's 30 minutes. What? So there's a huge variability in response times. And so that's, again, another misconception. Another misconception is it won't happen to me. There's this idea that I'm going to be, I'm a little bit like Teflon. It's going to bounce off. It's just not going to happen. Interestingly, there was a report out of Texas that looked at, there was all these rash of rapid number of deaths or near misses that was happening in Texas in dental offices, adults and kids. And when you look at the numbers of those events and you extrapolate it, you'll see that about one person dies per day due to an event that happened in a dental office. So that's about 350 people are dying due to an event that starts in the dental office. That's equivalent to two round trip flights from JFK to LAX crashing and everyone dying. All right, that's just the people that die. That does not include the near misses. The near misses is anywhere from a factor of 5 to 8 times that. So that's about anywhere from, just round it up, anywhere from 2 to 3,000 people that have near misses across this country every year due to something that starts in the dental office medically. So that requires them to go to the hospital. Okay, and there's a lot more than that where it's kind of like someone gets a little lightheaded or has a panic attack that doesn't require them to go to the hospital, and that's a whole nother number. But the idea is that when I start looking to it, these are real risks to people, and therefore, of course, affecting dentists and their teams.
So how do we do better? I mean, this is a problem. That's crazy when you put it like that about the round trip flights. That I love those analogies because it helps you conceptualize what the weight of it, the heaviness of it.
Yeah. And so that's a good question. Like, what do we do? So I don't want to get prescriptive too soon. I think the idea is where are we right now in the dental industry, and where do you want to be? So like when you compare high performance systems or high performance teams, like the analogy I used to use like a Navy SEALs, okay? But let's look at like the best hospitals, like Harvard hospitals, who I work with some of their people, or let's look at aviation, or let's look at the automobile industry, how they've improved safety over the years. Or let's look at also nuclear power. Like those are very high reliable organizations where they've taken safety as and own that as a pillar of keeping their organizations and their system safe. That is not being done in dentistry. And so when you look at what they're doing, it's very different. So the way I could best describe it is, and when you look at some of these theories and organizational safety, and it may take a step back. There is training, by the way, Kelly, out there for dentists and dental teams and hygienists and dental assistants, where you have online training for medical emergencies. There's books you can buy. There's CE credits that you can attend at a conference. It's out there. It's very readily available. It's often presented by dentists, oral surgeons, and dental anesthesiologists. It's available.
Right.
The problem is it's only one direction. It's like, I tell you something, you just do it. And that it has a very it's kind of like grade school. I know better, you listen to me, this is what you do. And it doesn't really allow for much engagement. It doesn't allow for much teamwork.
Right.
And often the people that attend it, who are they? They're typically dentists. They're typically occasionally dentists, hygienists will also have those kind of programs. But the dentists make it a part of their training to their CE to go to these. But it's very reactive. It's like, well, I haven't done medical emergency lecture in a while. Let me go to it. But again, you go to it, they kind of lecture you, and then you walk away. And quite frankly, most people don't implement much of what anything of these presenters are
You're not
doing.
applying it. You hope to not apply it, even.
Yeah. And so it's very this kind of it's this pedagogy kind of training where it's where one person's teaching you and you're just supposed to absorb everything. So that's one drawback of the current system. The second drawback is it doesn't involve the team. So in other words, it's just a dentist going. It's not getting the dental assistant, but your staff is not involved. And so so therefore everything is therefore on the dentist. The dentist has to know all this information and apply it in the moment, or the hygienist if they happen to go to that training as well. In other words, a very limited number of people in the overall practice. Now, so it's kind of like this pyramid idea where at the top is the dentist. Everybody's looking to the dentist. If there's a medical emergency in the office, tell me what to do. I will follow your lead. Okay. Am I wrong? Is that how you get it as well, Kelly?
I mean,
because
yes,
this is my impression, but maybe I'm wrong.
Right. So in theory, and what we teach in hygiene school, I can tell you because I've been there and I've done it for years, is that everyone's trained cross-functionally, the front office to the back office to everybody in between, about what goes down if there's a medical emergency. The one person, just like in the training videos for CPR, hey, call 911. Sally, you call the person out, call 911. I'm starting compressions. We have this. Okay. So everybody knows what to do. And there's usually, like in our clinic, in the practice, they would have a code word like 17 or something. We have a code, we have a 17, or we have a this. And that means that's a medical emergency. So someone would notify the doctor, because ultimately the doctor we're operating in a majority of states in dentistry underneath the doctor's license. So for that type of thing. So they have the liability of the practice.
Of course.
And so, yes, it falls on their shoulders because it's their practice. We can't by law own them. So it falls on the doctor to say, okay, what you're doing is appropriate, or say, no, I would do this, and take ownership of that. Because yes, from a standpoint of who's in charge, it is the dentist in that situation. Yes.
In your hygiene school, are you folks practicing this together?
Oh yeah.
Doing drills?
Oh yeah. The teamwork, you have to know, you have to do the role playing. Role playing is huge. And okay, this is what we have right now. how do we do this? We're bringing the stretcher in. We actually would bring EMS in to call EMS to simulate a real live medical emergency and what that would look like.
All right. And this is in the hygiene school.
Yeah.
Yeah. And so I'm familiar with that. Like, for example, I know NYU dental school does some of that as well. But in the practices, in the actual where the care is taken out in the community, it's less likely done.
Oh, yeah.
It's less likely done. And so you get this training as a student, but after a student, it doesn't happen. So, but all right, so that's what I've noticed. Like in a dental school, they get some training. I find it's a hit or miss, but yes, you're getting your training. And then once they leave dental school, they don't get that kind of training anymore. It's all presentations, it's all lectures.
Mm-hmm.
And also the dental dental assistant, the hygienist, they're not getting engaged in that too. When you look at the medical community, for example, it works differently. So you know how I kind of told you it's like a pyramid where we kind of look to the dentist. In the medical community, it's a little different. The best way I can describe it is it's like a beehive. So when there's a medical emergency, there's a swarm of people that come together, different specialties, doctors, different types of doctors, medical assistants, you have nurses, maybe a physical therapist. It depends where the setting is. But they come together and they respond to that medical emergency. And if someone cannot fill that role, another person comes in and fills that role to help support the team. All right. And they talk and communicate in a way that optimizes communication and leadership and role designation and decision making. And so it's not dependent on one person.
Mm-hmm.
In the dentistry, it's all on the dentist. And so the dentist, when I talk to dentists, pediatric dentists especially, they feel stressed, they feel burdened, they don't feel like they have a team that can support them. And as you know, when there's an emergency, we sometimes don't make the best decisions.
Mm-hmm.
And that's why you have to practice for the emergency. I used to have a coach, and he used to say, when emotions go up, intelligence goes down.
Mm-hmm.
When emotions goes up, intelligence goes down. So when there's a stress of an emergency going on in your office, and you start thinking, oh my goodness, this person may die on me, and everybody's depending on me, and I'm going to get a bad review, and I'm going to lose patients, and you start thinking of all these negative things, there's a cognitive overload that happens. And that person now is not able to function at a very high level.
Right.
And think through things like they would have, like the presenter just told me to. And so therefore the team now is totally dependent on the dentist, and the dentist now becomes paralyzed. There's a lot of case reports that have happened. There's an oral surgeon several years ago that I know of where they had a medical emergency in their office, an adult. And I wasn't there, of course, but this is what I heard is they were doing a sedation, they were doing a procedure. Patient wasn't doing that well, started to decompensate, oxygen levels started to go down, blood pressure started to go down, heart rate went down, and the oral surgeon froze. Froze. And the assistant helping him said, what do you want me to do? And he did not know what to do. And thank God, in that practice, there was at least another oral surgeon. They came in, kind of took over the scene, respond as best they can. And that oral surgeon who was responsible for that patient initially was described to me as just standing in a corner, frozen.
Wow.
Because the cognitive load was too much.
Yeah.
And that's a normal response.
It is.
A human response.
Yeah.
It's a human response. The thing is, we just don't train for it. In the dental field, we do not train for that. When you look at the best hospitals, these high performance organizations, they train for that. In the dentistry, we don't. Mm-hmm. Especially not in private practice. And as you know, ideally, you want to practice not just together with your team, but train in your environment, train in situ, right? Where the emergency would actually happen.
Right.
So that's kind of where you really want to do your training if you were to do it. So that's the gap. that I see is a need. Where how do you get a dental practice that wants to keep the practice safe, wants to protect patients at the highest level, wants to have a great reputation of safety, to bridge the gap to where some of the best teams for medical events perform. Mm-hmm. And so that's where I think the big gap is, and that's where I'm trying to bridge. And so to answer your question, team training is where it starts for me. I really believe it's team training.
Yeah.
Okay. Yeah. There's 4 pillars for, I think, to really address medical emergencies. Number 1 is your infrastructure. Like, do you have the right equipment, medications, the AED, your bag valve mask? Do you have the right lighting? Can people come in and out of the room appropriately? Like, that's all about infrastructure design, medications, equipment, supplies, visual aids, like a emergency manual. Okay, that's pillar number 1. And a lot of dentists do that. A lot of dental practices have that. Okay, number 2, the competence. Do people have CPR training? Do they have CPR certificates? Is it up to date? Is it? Do they have they actually gone to presentations and kept up to date with the latest information on how to treat with asthma or seizures or aspiration? All right. Do they have? Do the hygienists as well have that training as well? Is not just a dentist. So the rest of the team, do they have that individual knowledge that they can bring into the emergency?
To be part of the beehive, essentially.
To be part of that beehive. Do they have that base information? Do they even know where the, do they know, does the staff even know what numbers to call? There's a story I heard where when people call 911, people get such a cognitive overload, they forget what number they're calling from. They forget the address they're at. Because they're so flustered when they see something going on that's very chaotic, stressful.
Makes sense.
Just become overwhelmed.
Yeah.
And so they become, paralyzed. So that's the second pillar. The third pillar is what I describe as culture. It's that teamwork. Does a team know what to do in an event? So it's not just a dentist, like he can lead or she can lead, or even a hygienist. Anybody can lead an emergency.
Right.
All right. Like, what if your dentist is your patient, or the hygienist is your patient?
Yeah.
Okay. Like, does the whole team know how to respond to keep that person that they care about safe? So what I mean by culture is, do they know how to communicate? Mm-hmm. Do they know how to choose a leader? Do they know how to shift leadership? Do they know about roles and what roles they should have? Do they know how to make good decisions in the moment? Do they know how to use their visual aids or their CPR card? Are they familiar with it in advance, and have they practiced it together? So it's one thing to we know about it, but it's another thing when you actually stress test someone. It's another thing when you can put them in a simulated moment so that you can see where you can improve upon or what's really working, versus trying to figure out on a real patient.
Right. Yeah.
And so that's what culture is. And then the fourth one is, the best way I can describe it is like habit. So do you have these practices and protocols in place where you actually have a system where you can do all those 3 pillars, where you maintain your education, make sure your infrastructure is up to date, and make sure that your team is practiced on a regular basis. So for me, those are the 4 pillars that I think, if they're properly addressed, can keep a dental team and dental practice at a high performance team. And by the way, how you communicate in an emergency is often different than how you communicate in day-to-day. It's not like you can't use some of those principles in day-to-day communication, but how you communicate, how you lead in an emergency is different often than on day-to-day communication. And so you want to find tools that can allow you to do that.
So what do you suggest? Like, how does an office know when they're ready, or if they're ready, or how they need to be ready? I mean, you have folks who've taken CPR classes every year for a lot of years, or whatever that is. And You look around, you say, I see that, but you know that the right hand's not talking to the left hand. So, in a couple of minutes, how do you tell us how to do that?
So thanks for asking. I would like to say that CPR is often not enough. It's important, it's vital, but often people teaching CPR are teaching you a technique that you can do by yourself or sometimes with the team, but they're not really teaching you team dynamics. They're not very familiar with the typical things that happen in a dental office, and therefore you're not really getting the training you need in terms of optimizing your team work in a dental office medical emergency. Mm-hmm. So, as I mentioned before, I think it starts with your team. It's finding resources that allow you to train not just the dentist, but the hygienist, the dental assistant, and even the staff. And ideally, you want to have someone that can come into your office to basically, in one sense, stress test your team in a way that's safe. In other words, you don't want training where someone comes in and starts pointing out, you're doing it wrong, you're doing it right, and you create this sense of isolation for the people that are maybe not performing as best as they usually could because they're in the moment and it's stressful. Right. And so you want to find a team and trainers that can nurture your team as opposed to and build them up as opposed to put people down.
Yeah.
And so that's part of it. And I've developed a team that helps do some of that, where we are just starting to we just beta tested our program, tested in a bunch of dental offices, oral surgery offices, pediatric dental offices, where we go to dental offices and train their team. And we take what's working. So we take the tools that are being taught at Harvard Hospital and are applying it in a dental office.
That's awesome.
And so team training is a big deal. And I think it starts there. But for those people that are not even ready for that, they just want to assess things, by the time this podcast is becomes public, I'm hoping you'll be ready. But we're literally working on a medical emergency readiness index, where a dental office can go through those 4 pillars and see where they are in their readiness and track themselves.
That's awesome.
And gauge a dental assistant could do it, a hygienist can do it, even a staff can basically kind of go through it and get a sense of where they feel like their office is at. It doesn't just have to be just dentists, but that'll be coming out in the next month. So hopefully at the time this is launched or a few weeks thereafter, people can kind of take that.
That's like it's a scorecard that'll be on your website.
Scorecard. Yeah.
Yeah. To evaluate your office's readiness. So I think that's brilliant. And I really appreciate you. The beehive analogy was powerful as well, where you're exactly right. A hospital, we have a such and such stat, and everybody's, and in a dental office, everybody's like, who's doing that?
Oh my goodness. I heard this story, if you don't mind me saying, I heard this story from a dentist, a pediatric dentist. She said, we had this one, and she was working in the military at the time, and she was on staff there. And they had a mock drill where they were going to have a mock drill. And not everybody knew about it, but it's a mock drill. And when the mock drill was, they'd use a code word, like maybe 17. All the dentists and some of the medical people that were around converged on the mock patient. But some of the dental staff actually walked away and kind of started, that's how the best way to describe it is. They just walked away because I think even in a mock drill, if not done well, people don't feel like they can contribute, or that they feel scared that they're going to be part of something that they don't want to be pulled into. And the idea is this: there's training and there's just better training, and you don't want training that makes your team function poorly when it really matters.
That's exactly
you want to build your team up. Yeah. And so you want those kind of resources that can do that, because quite frankly, it makes your culture of your own office better. If you're a dentist or hygienist and you start and you bring in people that want to make your culture better and safer, the people around them are going to gravitate to that. That's what I believe. They want to be part of a team that cares about their people and about their patients and are willing to invest in those resources. So
absolutely.
That's what how I look at it.
That's awesome. Well, thank you. So everybody go to his website. It's in the show notes. There's going to be a scorecard down there and on the website that you guys can access. And so many times there's things that we go through every day that we aren't intentional about. Right.
Mm-hmm.
And we think that everyone's ready for it, but until you do it and you apply the information and you learn how to communicate in those situations, like in that instance where it's the medical doctors and the dentist around, when everybody converges on the patient, people need to be talking. All right, I'm noticing this, you do this. Somebody needs to take charge. And even if it's 5 people chiming in, okay, well, you figure out who's on first and who's going to do what. So learning how to go through those motions as a team. So Richard, thank you so much for bringing this important information. Reach out to him. And I think it's brilliant that you're putting this together that aligns with the medical model, because this is something that a lot of people don't think about it until almost it's too late and they're in the middle of it.
Yeah, that's probably the least ideal time to think about getting the right training.
Yeah. So preparedness is always important. So thank you again for being on today, Richard.
Oh, really my pleasure.
You being
our guest. Thank you for having me, Kelly. Appreciate it.
For all of our listeners, you guys, I always ask a favor, go on over to Apple Podcasts, give us a 5-star rating because Apple is the one that matters 5. And then go to YouTube, like, subscribe, share to the people you love and what you know who would love our podcast. Thank you for all that you do every day to save the lives, to impact those around you. And we will see you next time, my friends. Be well.